Hey, I have a new order here. I have to give Mr. Aguilar propranolol 15 milligrams. The pharmacy sent this medication for me. And would you believe these people? It said on the bottle 20 milligrams in 5 mils. I had to give this man 15 milligrams. How I gonna know? And they send big syringe. A 10 mil syringe in my hand and a bottle full with medication. And it's saying 20 milligrams in 5 mils. Lord help me. How I gonna find out 15 milligrams? How much mils I had to give this man? Hey, Oli, I don't know what to do. What to do? Help me, oh God, help me. Hey. Lord. Hey. Hi, welcome to my channel, all about nursing. Today's topic is calculating drugs. So let's get into it. We have an order and we don't even know how much mils or how much milligrams or how much of the tablet we're supposed to be giving these people. So what it is we supposed to do? We're supposed to calculate it. We have mathematics, yes, and we all know not all of us really good at maths. So let's talk about this. Drug calculations is so important because when you get an order, you have to make sure and give the patient accurate medication. If you give the patient too much medication, you can overdose the patient. If you give the patient too little bit of medication, you're underdosing the patient. So you're not doing what you're supposed to do for a therapeutic action. And we practice safe nursing over here at All About Nursing. So let's discuss this. Drug calculation. So what is a dose? We always see that dose. One dose, or the patient's going to have medication ordered for like 12 doses. What is a dose? Oh my gosh. A dose is a quantity of medicine that is taken or prescribed for a patient. So for example, we could give them a teaspoon, that's a dose. Not the entire bottle. The dose is how much you take from the bottle that is prescribed and measured for that patient. Then we have concentration. Concentration means it is the ratio of what is the active ingredient to the mils that you have or the milligrams that you have. For example, we have a product that is 12.5 milligrams in 5 mils. So it means every 5 mil of that product is going to have 12.5 milligrams. Units of measurement. So we all know there are different units of measurement. There's milligrams, mils, there's grams, there's kilograms, there's pounds. We have to know how to measure, how to count, how to change it, how to say, okay, how much milligrams make 1 gram? These type of things. So we're going to talk about, now we're going to talk about IV medication. We're going to be calculating some IV medication. Before we did oral, now we're doing some IV. We're going to be talking about our infusions. All right, so let's look at that board. So this one here is we're trying to figure out the length of time for the infusion. How much time, how much hours, right? So we have the amount we want to infuse. We have the infusion rate per hour, but we don't know how long it's going to take us. This is easy. So amount to infuse is going to be divided by the rate and it's going to equal to how much hours. We know that, right? So here we have 400 mils. We need to give this patient 400 mils and it's going to be 100 mil per hour. What we do, we divide the 400 mils by the 100, which is going to be, you're dividing the amount to infuse by your hour rate, which is going to give you the time. So our time of infusion is going to be 4 hours, right? So that's how we calculate your infusion time, right? Remember, infusion time equals amount to infuse divided by the hour rate or your rate, right? Then now we're trying to figure out our rate for the hour, okay? So we have the amount to infuse divided by the infusion time. So in this scenario, we have an order to give 3,000 mils and we have to give it in over 24 hours. Sometimes you see doctor order, give this patient 1,000 mils in over 5 hours, over 2 hours. This is how you're going to find out what your infusion rate is supposed to be. So you're going to divide the amount you have to infuse by the time that you are given to infuse it. So 3,000 divided by 24 hours equals to 125. 125 mils per hour is going to give our patient 3000 mils. So you see, these are the formulas that we use. As I said before, there are many different ways that we calculate medication, but it is to ensure that we give our patients accurate medication. Okay, drop factor. So all nurses know that we talk about drop factor when we have to give medication via the IV. And how do we get to know what is the drop factor? The good thing about that is we have formulas to calculate that as well, but we, instead of standing up and counting for one entire minute how much drops, we on the IV line packs has the drop factor. They will say how much drops will make 1 mil. So don't worry about that. You will get that answer when you have your IV line, okay? So your drop factor is how much drops this specific IV line will deliver to give you 1 mil, okay? So we have an order where our drop factor on this line is 10 drops is giving us 1 mil, okay? So let's keep that in mind. Our drop factor for this scenario is 10 drops is giving us 1 mil. Our order is we have to give 300 mils in 60 minutes. How do we calculate this? How do we calculate how much drops we need to have to give this patient 300 mils in 60 minutes? All right, let's do this. So 300 mils equals to 60 minutes. We want to know how much mils per minute first. Let's break it down. We want to find out how much mils every minute I have to give this patient to add and equal to 300 mils at the end of the hour, okay? So what we're going to do is divide the amount we have to infuse by the time, and it will give us the amount we have to give every minute. So here we have 300 mils divided by 60 equals to 5 mils. So every minute we have to give this patient 5 mils. How am I going to know how much drops I have to give? Remember, we have the drop factor. Our drop factor was 10. 10 drops is making 1 mil. I know your mind already ringing the answer. I know, but let's do it. So 5 mils in a minute equals a minute. X equals to 10 drops. So we need to find out what is X. So we cross multiply again. Yeah, we're back in school. Back again. Cross multiply. So 5 by 10 is 50. So it means that we're going to be given X. X is going to equal to 50, which is 50 drops in a minute is going to give you 300 mils. Now you could back count that, okay? So if I'm given 50 drops, which is 5 mils in a minute, and I multiply that by the 60 because I can multiply the amount I'm given by the time to make sure I'm giving the right amount. So see how you could cross-check your medication? So now we know we're giving 50 drops in a mil in 1 minute, which is equivalent to 5 mils, right? So 5 mils multiplied by 60 is going to give us 300. So see, nursing medication calculation, it is intimidating, but it's fun and it's easy. All you have to do is relax your mind, follow your formulas, don't rush yourself, and you'll be able to get it, okay? So that's how we do drop factor. That's how we do the how much mils we give it in a minute, and you break it all the way down to your drop factor. So today we finished our talking about some medication calculations. I hope you guys learned a lot from the examples I've given, and I hope I made it simple for you to understand. So look out for part 2, where we will talk about more medication calculation formulas and how to calculate medication accurately. And remember, nurses do it better. See you guys. Bye.